Welcome everybody who has already logged on. We have just started up. I'm going to wait just another moment to arrive fully at 12:30 for the scheduled start time. But just wanted to go ahead and get everything set up on my end to make sure that everyone could see the screen from the beginning, unlike last week. So thank you once again for joining us, and we will get started here in just a moment. All right. I think we will go ahead and get started. Thank you once again for joining us. And if you attended the webinar last week or watched it after the fact, much of this will look familiar to you. It's pretty similar in terms of its content. There are some adjustments overall in terms of the actual recommendations for timings and dosages of some of the specific supplements. There's also a little bit of updating on the epidemiologic data, which I am excited to share and talk about. So let's get started. First off, too, I did just want to say thank you very much to everyone who provided feedback after having witnessed the webinar last week. That was very helpful, and it was definitely clear that there was a lot of technical detail that I covered. I felt that that was important to laying the groundwork for what I wanted to discuss last week. We're going to kind of skip over a lot of that this week, so hopefully this will be a little bit more actionable advice for most people. If anything is unclear, if anything's been left out, if there are any questions that come up, please do feel free to write in via the chat mechanism included in this GoToWebinar platform. You're also certainly most welcome to reach out to me by email or to give the office a call. Be happy to address any questions or concerns one-on-one, certainly. Please do keep that feedback coming with respect to this week's webinar. And furthermore, if you have ideas or requests for topics that you would be interested in hearing me present on, I am very open to that. I will definitely be letting everybody know about what's coming next week at the end of today's webinar. As a brief recap, COVID-19, which is really what's bandied about a lot in the news and amongst friends and on social networking platforms. This is really the disease process that results from exposure to this particular virus, which is the severe acute respiratory syndrome coronavirus 2, or the SARS-CoV-2. So COVID-19 is actually when symptoms emerge, and as we are hearing about so often nowadays, when things get particularly acute and intense and require more higher levels of intervention, typically at a hospital. The last count of confirmed cases throughout the world as of this morning, I believe it was updated last night, was a little over 1.94 million confirmed cases. When I spoke to you last week, that number was only 1.35 million. So we're definitely continuing to get more cases. That's to be expected right now. And the fatality rate, unfortunately, also seems to have gone up a little bit. It's now at about 6.2% of those confirmed cases, whereas last week it was at only 5.6%. Now that does sound somewhat concerning, admittedly, But the reality is that we are talking here about actual confirmed cases, and that definition in and of itself is inherently problematic. I saw a very interesting study that was recently published and written up in The Economist over the weekend, and it really highlights this distinction between what is a confirmed case versus what is a suspected case. The challenges thus far in making sense of the data that we're getting around this disease process are that we really have not been able to get an accurate read on the number of infections that are present in our society and throughout the world. The tests from the beginning were really reserved for those individuals who were demonstrating obvious symptoms. So there were a lot of people who, as it would seem, actually did carry this virus, were infected, but whose symptoms were not severe enough to warrant actually running the specific test on them. These would be people who were actually asymptomatic or maybe just had a low degree of symptoms, or possibly even something that wasn't typical for what doctors and scientists were coming to understand was the classic presentation for this disease process. Interestingly, though, people with bad enough symptoms would go to their doctors earlier on, say last fall, around the start of the year, and even into February, and would be worked up for a suspected influenza. And that testing would come back negative because it's a very different virus, and it would not actually result in a positive test for an influenza test. So these groups of individuals were lumped together into this ILI category, influenza-like illness that was not influenza. And some very smart scientists, people who are good at math, much better than I am, took a look at these reportings of cases and saw, as you can see in this graph on the right, that things really started to pick up with respect to these ILI cases at the end of February. I mean, there was definitely an increase back into last fall, but boy, the end of February, when this whole COVID-19 situation really began to emerge in public awareness, that's when this statistical aberration from the typical numbers of these ILI cases per year really lifted off. These mathematicians were able to extrapolate from this change in data, basically that there were approximately 23 million more cases of this non-flu influenza-like illness in March, so between March 8th and March 28th. And that is suggestive of that many number of cases of COVID-19 that actually weren't recognized as such. From that calculation, they were able to make a further calculation to estimate that perhaps 1 in 100 to 1 in 1,000 of the actual cases of COVID-19 that were out there, infections with this SARS-CoV-2 virus, were being picked up. So the other, anywhere from 99 to 999, were just getting missed because they were individuals who were not expressing symptoms, or were expressing symptoms really at a very low level that it didn't really come to the attention of the scientists and physicians who were responding to this situation. So to me, that is actually a very reassuring finding, a reassuring scientific extrapolation saying that probably a lot more of us have been exposed to this and gotten through it relatively unscathed than most people typically realize at this point in time, which leads me to think that there's a greater expression of herd immunity that has been developing over the past couple of weeks and will put us as a society and as a species, honestly, in better standing going forward. Now, that certainly does not diminish the reality of people who are struggling mightily with this infectious process right now, and people who may not have yet been exposed to this virus and still have that whole process to go through. And that's really what we want to be talking about here today. Like we talked about last week, how can we best prepare? And today, once symptoms do start to emerge, what can we do to change our tactics? Now, just as a recap, the COVID-19 disease process is really somewhere on the spectrum of the expression of this cytokine release syndrome, which is somewhat akin to my mind at least, a nuclear chain reaction. At the very low end of the spectrum, this may not even be noticeable or could just be sort of a typical flu-like illness, malaise, fatigue, a little bit of fever. And at the high end, what we would call a cytokine storm, which can really be life-threatening in its most extreme forms. Preventative behaviors we talked about last week, of course, the physical distancing that we're all practicing right now, frequent hand washing, being mindful about where our hands have been, what they've been in contact with, and doing our best not to touch our faces, eyes, nose, mouth, and so forth, unless and until we have washed our hands thoroughly. Definitely want to avoid close contact with people who are ill. Cover your mouth and nose with a tissue if you have to cough or sneeze, and don't reuse those tissues. And then be mindful about cleaning, disinfecting surfaces, as well as objects, in particular eyeglasses, earbuds, phones, things that we're using a lot and bringing up towards our faces a lot. And then you can certainly choose to wear a face covering when you go out in public. The more densely in association with other individuals you are, the better an idea that may be. The more immunologically challenged or immunocompromised you may be, the better an idea that becomes. And certainly if you're going to be around anyone else who is in those categories, that would also definitely be a very good idea. And again, just a reminder of the surface life essentially of this virus on different media. So, at the high end of the duration, metal and glass and ceramics, and certainly at the lower end, copper, aluminum, things like that. But in the middle, again, this idea of plastics, I highlight this just because phones, earbuds, glasses, that's really important for us to be mindful about keeping clean and sanitized, especially when we return home from being out and about, wherever we happen to have been. Other types of behaviors that we can practice that will be good in terms of minimizing the spread of this virus: staying hydrated. Our immune systems need to have adequate amounts of fluid in our system in order to function at their best. Sleeping adequately. It needs to be consistent and it needs to be restful. Our immune systems do so much to recover and restore and revitalize us while we sleep, so that's very important. Air humidification is another key piece. The virus does not do as well in this 40 to 60% humidity environment. So especially here in New England, especially coming out of the winter, dry air is a reality of our existence. So if you have a humidifier, certainly make sure that the filter is clean, but that can be a really good idea right now. Regular exercise that's appropriate for where your body is and what it's capable of is also helpful for supporting the functionality of the immune system. And then to the extent that we have food allergies or sensitivities, which is one of the areas that I work with my patients, removing those from our food choices will definitely make it less burdensome for our bodies to deal with this nutritional intake that we provide ourselves on a daily basis. Meditation is a choice for supporting the functionality of our immune systems. It definitely supports their ability, all the different components of the immune system to function at their best. And it also really helps to reduce the experience of stress as noticed by the release of cortisol, stress hormone coming from the adrenal glands. So that can be a fabulous practice, especially if we're stuck at home and we have a little bit more time on our hands now than we are used to having. That can be a great option to support ourselves and to fill some of that time. And certainly stopping smoking, if that's something that applies to you, that's a great choice. In terms of diet, definitely favoring plant-based sources of food, ample and diverse fruits and vegetables, 10 servings a day, lots of colors. That's a great way to go. Ample amounts of protein. Doesn't have to be too much, but we do need adequate protein coming in on a daily basis. The various components of the immune system are all largely comprised of protein. So we want to make sure that we're getting enough of that so that our immune system can keep regenerating those different core members of its roster so that it can keep doing what it needs to do. And then, of course, this list of specific foods that are particularly helpful for various different reasons. But as long as you're getting that 10 servings of fruits and vegetables a day, lots of variety, that should be more than enough. Now, last week we did talk about the specific supplements for supporting prevention of the development of COVID-19. That list is recapped here. I broke it down last week into 3 different groups depending upon how robustly you wanted to go after this sort of preventative measure. But definitely as a strong recommendation, the core suggestions, the multivitamin, vitamin D, vitamin C, and zinc, those would be suitable for just about anybody. The key with zinc, of course, being it's best taken with 2 milligrams of copper when you're taking 30 milligrams of zinc, a ratio of about 12 to 15 to 1 of those 2 elements, just because zinc, being a key component of how the immune system functions, does use up the supply of copper. And if we run out of copper, there can be some neurologic side effects that can result from that. Everything else we will see again. And again, just depending upon how robustly you wanted to go after this sort of preventative approach, you could include some or all of these items. Now, in terms of the actual development of COVID-19, here are a list of symptoms ranging from the most common, of course, fever, cough, to the pretty common sore throat, fatigue, malaise, shortness of breath, headaches, anorexia, which is really just a fancy way of saying you don't feel like eating. Oftentimes you don't even feel like drinking too. And at the rarer end of the spectrum, the runny, stuffy nose and or diarrhea. When you start to notice any of those symptoms, this is where we're going to really start to talk about what types of measures can be done from a supplement perspective. Now, I bumped stinging nettles from the 3rd group all the way up to the top, simply because this is one of the items that can be taken throughout the day in an ongoing fashion as a tea. And this sort of accomplishes 2 things simultaneously. It really helps to support adequate fluid intake, and it does provide the immune system with this key component of stinging nettles, which is helpful for inhibiting the virus's entry into the body cells. It's helpful for diminishing the virus's ability to replicate, and it will also decrease the expression of the ACE2 receptor, which we talked about a little bit last week. So you can drink this tea throughout the day, all day, and it will be also, as I said, a good reminder to keep pushing those fluids, which will be very important while your immune system is working to overcome this virus. If that's not really your thing, if you prefer to just take a supplement, you certainly can get this as a formulated capsule of the dried herb, and you could take 500 to 600 milligrams, depending on who's formulating it. There are different dosages, but you could take that 3 times a day if you wanted to. To specifically address the presence of the virus within the host body, within the individual, there are any number of antiviral supplement supports. These 2 different companies, Biobotanical Research and Researched Nutritionals, are 2 of my favorite. They are exceptional. These both definitely fall into that category of pharmaceutical grade supplements, which I spoke about briefly last week, and we can touch on again here today. But what I like about these two in particular is that there is a complement of different options that are available. With biobotanical research, this formula that they have concocted, which they call biocidin, is a liquid formulation. It comes in a couple of different forms, but the liposomal formulation is the one that I would recommend because it's packaged, is formulated in such a way that it is very readily absorbable, even beginning in the mouth. It's a liquid that you essentially spray into either a small amount of water, or you can put directly into your mouth. And it can begin to be absorbed across the mucosa of the mouth and get into the bloodstream that way. That same formulation helps it to go intracellular, so into the interior of your body cells as well, which is where this virus can be found and where it's doing its work of self-replicating by hijacking the host body's own cellular replication machinery. So this is a great formula. It's a blend of different herbs that have antimicrobial properties. So that works against viruses, it works against bacteria, it works against parasites. It's a really fabulous formula. And that would be sort of the mainstay of this antiviral support protocol in terms of the biobotanical research offerings. Now, they do have the same formula in a throat spray. It's not that liposomal formulation, but this would be, I would recommend taking this with the beginning of any sore throat, any raspiness, feeling like, this could be the beginnings of something. The Biocidin throat spray is a great response to that type of self-awareness that you might notice. They also offer an encapsulated product called Oliverex, which is basically a highly purified extract from olive leaf, which has known antiviral properties. So those three together, or some combination of those three, would be a great specifically antiviral support protocol. The research nutritionals options would also be great. These are a little bit different in their focus. The transfer factor multi-immune is sort of the foundation piece. This would be a capsule that's a combination of different nutrients, herbs, some specific mushroom constituents, and these are intended to specifically support the functionality of the natural killer cells, which are a component of the innate immune system that we all possess. They have additional sort of layer on options, and for a specific viral issue, the transfer factor plasmic, and which is also a capsule, and a liquid formulation, which is known as BLT. Those would both be great choices for any sort of SARS-CoV-2 suspected infection or COVID-19. Returning to the supplements that we discussed last week, I would continue to recommend a multivitamin. There's no need to change the dosage of this particular supplement. It's really according to the instructions on the bottle, but pharmaceutical grade, high quality, broad in its spectrum of nutrients, a good cohort of B vitamins, C, D, A, E, plus some of the trace minerals that will provide your body with the raw ingredients of what it needs to be able to do the normal functions of expressing health. As we talked about last week, it's starting to become more known, and certainly has been looked at in the research, that even if we eat a pristine, organic, plant-based diet, diverse in foods chosen, our bodies just don't get the full complement of nutrients that we need here in the 21st century. So a multivitamin remains a strong recommendation when dealing with the symptoms of COVID-19. I continue to recommend vitamin D for all the reasons listed here. The change that I would suggest at the onset of symptoms would be an intense, short-lived augmentation of the dosage. Normally, I usually suggest around 5,000 international units a day of a high quality vitamin D, preferably liquid, just the body does a better job in my clinical experience of absorbing that. But with the onset of symptoms, and this could be flu, or this could be COVID-19, or could even be just a head cold, 10,000 international units taken 3 times a day for 3 days. So that would really be a dose of 90,000 international units over those 3 days as a way to acutely boost the reserves of vitamin D in the body to support the immune system's function. Once having gone through those 3 days with that acute dosage of the vitamin D, and again, this is vitamin D3, not D2, you could then revert back to the standard dosage of 5,000 international units once a day. Now, ideally, this would be dosed, the ongoing level of 5,000 would be dosed based on blood testing. Not everybody has necessarily had that. I definitely recommend it. I am seeking to achieve a target serum level of around 70 milligrams per milliliter. I'm sorry, that should be nanograms. That was a little typo there. 70 nanograms per milliliter, not milligrams. And, you know, anywhere between the 50 to 90 range is appropriate, 70 being ideal. So ideally we test, and ideally we could adjust our ongoing administration of vitamin D based on the results of that testing. Barring that, the 5,000 should be just fine. Vitamin C had also been a regular core recommendation. I would change the previous amount of 1,000 milligrams twice a day to 1,000 milligrams every 30 to 60 minutes, which is going to be a lot. It sounds like a lot. And in fact, taking that much can lead to pretty noticeable diarrhea. It's basically bowel tolerance is what we're going to use to notice when the body has gotten enough in that moment. If loosening of the stools develops in response to that increased dosage, then essentially back off the frequency of the administration of the vitamin C. But vitamin C is very important for its antioxidant effects, for its support of the immune system, both innate and adaptive, and it's been particularly noted to be helpful in respiratory tract infections. So this is really a great choice, and there's no danger apart from inducing diarrhea in oneself by taking these higher dosages. Some hospitals, not all of them, are using intravenous vitamin C administration for their suspected or known COVID-19 patients. And this is basically a way to do the same sort of thing at home, although there is that potential of the body saying, that's too much just now. So if that happens, just back off a little bit, but keep taking it as your body will tolerate. Zinc was the last member of the core recommendations. Previously, I had suggested 30 milligrams once a day with food, and I would say just take 30 milligrams twice a day now. So with the morning meal and with the evening meal, do the best you can. If that anorexia is a part of the experience, that just lack of appetite or desire to eat, then try to eat a little something. Zinc is best taken in along with other foods. So having some food in the digestive system will support the body's ability to absorb it and make use of it. I also changed the position of melatonin. I wanted to move this up. I didn't think that this was as robust of a recommendation without the onset of symptoms, but there is so much accumulating evidence suggesting and showing that melatonin is particularly helpful in the setting of COVID-19 that I wanted to make this a much stronger recommendation if symptoms are showing up.
Previously, I had said 5 to 10 milligrams at bedtime. I would say, in all honesty, half a milligram to 1 milligram is enough to get physiologic levels of this hormone circulating in the body, basically equivalent to what the body itself would produce. But taking 10 milligrams, there is no danger in taking that much melatonin over a short period of time. And this would just help to ensure that its presence was robustly felt within the system at that time. And as we talked about last week, and you can see in the graph, children up to about age 10 seem to really have the highest levels, and then that tapers off pretty dramatically as the years accumulate. And this is part of the rationale behind using melatonin in this context, that because we've seen that kids under the age of 10, by and large, do not struggle with the clinical impact of this virus to the extent that adults and certainly people with comorbidities, with pre-existing conditions do. The diagram here on the right helps to show in a little bit of a schematic format all the ways in which melatonin is helpful. So again, I would just say 10 milligrams when you're ready to go to bed for the night. I also moved quercetin up a little bit. This is an important flavonoid present in a lot of different Chinese herbs, vegetables, fruits, and it's very helpful in this specific clinical context. So I would say take 1,000 milligrams 3 times a day. You're basically going to be dealing with more frequent dosages once symptoms arrive, but the intent behind that is, with respect to all of these supplements, that we're just going to continue to provide the body with these support elements so that the immune system is always resourced as fully as it needs to be to do what it needs to do. In the same vein as quercetin are other components from plants, Chinese herbs and so forth, resveratrol, curcumin, and EGCG. If you wanted to, again, just do everything that you can, you could take each of those as well, the dosages listed here, at the same time as you're taking the quercetin. Vitamin A has not changed at all. This is one vitamin that we do need to be a little bit careful with. It is possible to overdose on, and in the case of a woman who is pregnant or may be pregnant, that has the most serious ramifications. Otherwise, there can be less concerning issues, but really there is no change here, just that it continues to be an important component of supporting a healthy and responsive immune system. If you know that you are deficient, then 30,000 international units of retinol for 3 days before dropping back down to 4,500 international units would be recommended. And certainly never over 10,000 international units if you are pregnant or may be pregnant. Probiotics also are very important. These would change slightly if there was a need for antibiotics. Now, antibiotics, of course, are not going to do anything to address SARS-CoV-2 and its presence in the body. However, in some cases, when a virus takes hold in an individual, that can predispose the individual to a greater likelihood of bacterial infections. And there may be basically a concomitant bacterial infection for which antibiotics would be indicated. Now, if that's the case, then I would say probiotics as before, but twice a day, and to be sure to include Saccharomyces boulardii in the overall mix of probiotic strains. Saccharomyces boulardii is a particular strain of beneficial yeast, not bacteria, that is included in certain probiotic formulations. It will not be affected at all by antibiotics, and that is why I definitely recommend that for patients who need to take antibiotics. And again, twice a day instead of just the once daily dosing as before. Alpha lipoic acid is another Excellent, excellent, excellent antioxidant. It does a really good job of getting to the brain as well as throughout the body. So I would say take 300 milligrams twice daily, as I had before. Beyond that sort of cohort of robust recommendations, you could also consider the addition of glutathione. Again, the key here is to take the forms of glutathione that are best absorbed, taken up, and utilized by the body. So the S-acetyl and the liposomal formulations of glutathione. And previously I'd said 100 milligrams twice a day. You could do 1 to 200 milligrams twice a day. You can even get this as 300 milligrams. This is a very expensive supplement. So even just taking 100 milligrams twice a day would be great. But if you really wanted to go for it, you could take 300 twice a day if you wanted to. And then I would also continue to suggest bovine colostrum. This is actually one of the ingredients in the researched nutritionals transfer factors products that I recommended earlier as the targeted antiviral products. 900 milligrams twice a day of this would be fine. This is going to be very helpful in providing a more beneficial environment in the gut, as well as certain immune factors, these transfer factors throughout the body that are absorbed across the gut lining. As I mentioned last week, the importance of pharmaceutical grade supplements really cannot be overstated. This speaks to a higher degree of quality and quality control in the manufacturing process. Standardized dosages, no extraneous additives. This is the way to ensure that your body is getting the benefit of what you're trying to give your body by way of taking these supplements. There are any number of brands that sort of meet the criteria of being considered pharmaceutical grade in terms of their quality. I work with a lot of different brands. The particular online supplement dispensary platform that I use, FullScript, carries only pharmaceutical grade supplements. This is something that I have really chosen to focus on and specialize in my practice, and would be happy to speak with any of you about further if you had questions about the quality of the particular brands of supplements that you're taking. Part of that, and one of the reasons why I do use FullScript, is that you also want to be mindful of the conditions in which these supplements have been stored and transported from the manufacturer to you, the ultimate consumer. You want products that are not past their expiration date, that have been kept in appropriately climate-controlled conditions. And you also want good customer service behind the sale of these supplements, such that if you have issues, that you know you're going to be able to get your issues resolved. Talking a little bit more specifically about my practice right now, I am doing largely a lot of study, self-development, and then exclusively telemedicine consults with my patients. Not really able to do osteopathic treatments right now. That will change as this whole COVID-19 situation resolves in due course. But I am wishing to make this resource of lifestyle, diet, supplements more available to people. So I've been offering these 15-minute complimentary consults to anyone, whether a patient or not. And anyone is welcome to contact the office to schedule one of these consultations. If you would be interested in more detailed consulting with me, then I am accepting new patients, and we're breaking these appointments up into an initial 30-minute appointment, and that would be followed in time once we're able to have in-person appointments with the second half of that full hour initial consultation. So that would be a 30-minute online and then a 30-minute in person later on, hopefully this summer. Individuals who are already patients are also certainly welcome to take advantage of the complimentary 15-minute consults, or to schedule a follow-up 30-minute consult online for whatever is wanting to be worked on next. For those individuals who are not currently patients, who would be interested in signing up for one of these 15-minute complimentary consults, I am offering a 10% discount to all products available through FullScript, this online pharmaceutical grade supplement dispensary that I use. And that would continue in perpetuity. That's a lifetime discount. My existing patients have access to a 15% lifetime discount, so that's great for them. And if that feels like more than you would be interested in taking on, you can certainly avail yourself of the complimentary consult and have access to the 10% discount. Now, I mentioned this a moment ago, but basically, once this starts to loosen up and we're able to meet together in person, I will be definitely seeing patients for new functional medicine consultations, new osteopathic treatment appointments, existing patients for either of those areas of concern, and would still be able to do the remote consultations for any functional medicine concerns if that made more sense for the individual. Now, next week, the topic that I am very much looking forward to presenting on is a new approach to exercise. And that is even really an overcharacterization of it. It's a physical activity that is more about changing how your body is signaling the utilization and storage of calories that are taken in by the foods that you eat. This is an approach called Fastercise. It was developed by Dr. Dennis Wilson, and it's been sort of turned out into the world by his daughter, Allison Roberts. She was, as he says, the earliest adopter of this approach. She used it to be able to go from giving birth to her child to 8 months later competing in a bodybuilding contest. And it's really a pretty remarkable story that the two of them share. And he is, I can't say enough about how great of a presenter he is, how knowledgeable as a physician he is, and how excited I am to have been able to work with him thus far in my understanding of this approach, Fastercise, and to learn from them what is possible with this. I've been using it myself. I've been recommending it to patients, and I'm very excited to share more with anybody who cares to tune in next week. So just in closing, I wanted to put this list of the supplements up while I take a look at some of the questions that may have come in. Let's see. Okay, so there's a request for the slides and then a one-page a request for a one-page list of the actual recommendations. So I will leave that up for a moment or two longer, and let's see. Whoops, let me go back to that. There is that. And let me see what other questions might have come up. I think that's everything in terms of what I'm seeing from attendees. So feel free to get a screen grab of that, to take some notes, whatever makes sense for you. And I just wanted to say thank you very much once again for tuning in. This has been an interesting way for me to spend my time these past couple of weeks as our reality has shifted so drastically. And it's been very fun. I notice about myself that I really do enjoy sharing information with helping to educate and inform. And this has been a new way for me to be able to express that professional interest. So thank you for tuning in. And let's see, one other question came in. A retinal face cream, does that affect the body? So retinol is often used as a topically applied supplement for the skin. It can be very helpful for a lot of different reasons, helping to smooth out fine lines and wrinkles, to reduce signs of aging and so forth. It shouldn't affect too much what is applied topically in terms of your overall levels systemically. The best way to know for sure would be to get a test and check. But if you're just using a little bit on your face once a day, I would not be terribly worried about it. Especially if you stick to the 4,500 international units recommendation for vitamin A, you should be just fine. Let's see. And then one last question about the 15-minute consult. The best way to do that would be to call the number on the screen, send an email to me, and either myself or Surya, my office manager, will be happy to get back in touch with you to schedule that. All right. I think that's all the questions for now. If I missed anything, please feel free to reach out, call, email. If you're a patient, message through the portal, whatever works for you. Stay safe, stay healthy out there, and best wishes. Thank you, thank you, thank you.